women's essential body fat percentage is between 10 and 13%. So to survive, we need to have a higher fat percentage. Even to give birth, women have to change the shape of their pelvis in order to pass a baby through it. So we don't cheer for anyone, we cheer for ourselves.
Welcome to the Visionary podcast, where we discuss science, medicine, physical health, and mental well-being. I'd like to ask you about sports specialization in children. I have a 9-year-old child who's waiting outside this room right now, politely reading a book and eating some cashew nuts. Which is better for her, to have one sport in her life that she is doing brilliantly, gymnastics, for example, or 2 or 3 with the knowledge that she will not be amazing in any of them due to divided attention and limited time. Which model should parents aim for?
So there has been quite a bit of research into this. I think in general, as well as the research showing that it tends to be more of the individual sports that a lot of children tend to specialise early in. So that's things like gymnastics, like you mentioned, dance, and things like that. The team sports, we see less of the sport specialisation. It tends to be, there has been research on the effects of early sport specialisation on children. And I think that the concerns are that early sport specialisation doesn't necessarily correlate with success later down the line in that sport for a number of different reasons. And there are risks associated with early sport specialisation. So if you've got a child doing the same repetitive movements associated only with that sport, you do risk overuse injuries. So if I look at gymnastics as a specific example, the repetitive arching of the back. Now, I want to scare you. I'm not saying that your child's going to develop this.
To death.
So repetitive forceful extension of the back, particularly in the absence of the appropriate conditioning techniques, strengthening exercises, can lead to problems with the spine and fractures in the spine and things like that. That's just one example. There is a risk that of psychological stress. So if there is a lot of pressure put on that child in that sport, there is more of an overwhelming stress and strain on that child to perform and to do well, because that's the only sport that they're doing. And there is also a risk of a high dropout rate at an early age if they are overdoing it in that sport. So there are plenty of both individual and team sport athletes that haven't specialised too early. I mean, I should give an example off the top of my head. So Yannick Sinner, who's the current tennis world number 1 in the male division, male singles, he did 2 or 3 different sports up until the age of 12 or 13. Obviously, he did tennis from a young age, but he also skied. He was quite a good skier as well. He didn't solely focus on tennis until about the age of 12 or 13 years old. And the evidence suggests that probably is, if you were going to have to pin me down and say what is the optimum age of starting sport specialisation, it would be those kind of 12, 13 years olds. But yeah, it's there's mixed evidence, and certainly doing some sport is better than no sport. And if there is a sport that they genuinely love, and it means that if they do multiple sports they're not going to enjoy life as much, then obviously you're going to say, well, do the things that you enjoy.
Yoga or Pilates for flexibility?
Yoga.
Oh, really? I thought you were going to say it depends. So that's what I know.
From my understanding, Pilates is more stability and strengthening. Yoga takes you through more kind of stretching exercises. That's my experience of having done both. But obviously I'm not a Pilates or a yoga instructor, and they can be intermingled. They can be merged into one class where you're working on both. But personally, yoga for flexibility.
Lovely. For us middle-aged women like myself, I'm 47. If I have very little time, like 30 minutes a day, which is usually true, apart from the weekend, what should I go for? Cardio or strength training?
First of all, I'd say amazing. 30 minutes every day free that you've identified as a good way to do some exercise is the first amazing step. Most people just go, I can't possibly think about doing any exercise because I've not got any time. So first of all, I'd say that's super. I'd do a mixture. I do. I'd really mix it up if you can.
Okay.
So HIIT training, so high intensity interval training, can incorporate both. So you're doing some cardiovascular exercises, like some shuttle runs, so jogs or burpees is my favorite exercise, because it incorporates everything. It's cardio. You're also engaging your core with every burpee. You're doing a chest to floor, so almost a whole press up in it, and you're also doing a squat jump. So you're strengthening as well as every part of your body, but you're also doing some coordination work with it, and you're also doing cardio. So
amazing mix.
So burpees.
Is it sexist to ask if I should exercise differently than a man?
I don't think so.
Should I exercise differently than a man?
That's a very,
I'm 47, he's
it's a
47.
very interesting question.
I don't have conditions that would interfere with my ability to work out. He's the same. Should I, let's say, do more, do less, do different things just solely due to my biology being a woman?
First of all, if you look at the science of it, women are genetically different to men. So women have naturally a higher body fat percentage than men. Essential body fat, so men's essential body fat, so that's the amount of body fat needed to physically be surviving. Men's essential body fat is between 2 to 3%.
Only?
Very low. So women's essential body fat percentage is between 10 and 13%. So to survive, we need to have a higher fat percentage than men. With that, men have a much higher lean muscle mass compared to women. So if you take a 47-year-old woman versus a 47-year-old man, and they both have exactly the same diet, exactly the same activity levels, the man will have a higher muscle mass than the woman. Genetically, that makeup is why. So that we do need to factor that in as women when we train. You know, we are not going to be able to lift as much as a man.
Okay.
You know, if
That's
we train
one
the
of the
same
implications, right?
Yeah, if we trained exactly the same in exactly the same way, the lifting weights and things like that, the man will naturally be able to start lifting more because of that increased muscle mass.
But I will be lighter, so I can do cardio better
Well,
than him.
I'm not saying that women can't do things better.
No, I understand.
You know, just differently. So women are more flexible than men naturally. So again, if you have a 47-year-old woman with a 47-year-old man, and they've both done minimal flexibility, you know, same amount of flexibility training, you know, the woman will naturally have a higher level of flexibility due to sort of differences in the makeup of their tendons and their ligaments. You know, even to give birth, women have to change the shape of their pelvis in order to pass a baby through it. So our ligaments are naturally more flexible to allow for that. But obviously you have changes throughout childbirth and pregnancy that allow for that as well. But women actually have, you know, a higher percentage of type 1 muscle fibers.
What is that again, please?
So you have two types of main muscle fibers. You've got type 1 and type 2. Type 1 muscle fibers are muscle fibers that can contract more slowly but for longer lengths of time. Type 2 muscle fibers are those really quick, fast twitch. They contract very quick, very fast, but can only do it for a short space of time. So your sprinter, your 100-meter sprinter, will have a higher percentage of type 2 muscle fibers than your marathon runner. He will have a higher percentage of type 1 muscle fibers. There's a theory that women naturally have slightly higher percentage of type 1 muscle fibers than men. So there's slightly more advantage when it comes to endurance training.
Cool.
Yeah. So it's not all doom and gloom, but yes, these are some things to bear in mind, but obviously training can change this massively. So I wouldn't limit, you know, there's no need to limit yourself, but you can't, it's really hard to compare directly with.
Yeah, I understand. Just
men.
General guidelines. Should I adjust my workout based on where I am on my menstrual cycle?
What some of the evidence might be suggesting is that during the period of time when you're bleeding, so when you're menstruating, our estrogen and our progesterone levels are at their lowest. Naturally, this makes you feel a little bit more fatigued, a little bit more tired, a little bit more irritable. But as well, we have to bear in mind, and this I know for a fact, is some women tend to bleed quite heavily during their periods. Heavy, so they lose more blood than what their body can cope with, and so they become anemic during their period, and that can also have an effect on our fatigue levels. Being anemic means that our blood is far less effective at carrying oxygen around the body, and obviously our muscles need the oxygen to move and exercise and be activated. So you can feel more short of breath, you might fatigue a bit more easily. So this is something to consider as well, and actually making sure you're not anemic if you're starting to feel these things.
Hi, I'm Hala, your host today. If you're enjoying what you see, please hit that lovely subscribe button. It would mean a lot to me and my team. Or maybe it's more now. We're still learning, we're still finding our feet, but with your support, we can build this channel. Let's take this journey together, one step at a time. Thank you so much for being part of it. Nicole, you had an experience with emergency medicine. You also studied musculoskeletal medicine. Injuries can be sudden when someone goes to accident and emergency after a sports injury. What do emergency doctors usually miss or overlook?
From my experience, when a patient comes in with an acute injury and pain in a joint or in a certain area of the body, that part of the body is x-rayed pretty much straight away in A&E. And if a fracture is not identified on the x-ray, if all is reported as normal, then it's very much, okay, it's just a soft tissue injury. Off you go, bye, rest, ice, compression, elevation, you'll be better soon. I think we could do a bit better. And I think if there was a little bit more time and resources given into A&E and the acute setting, so what, it's not a break. There can be a load of other things that might be seriously injured. I take the knee, for example. I've seen a patient in my practicing GP who twisted their knee at work and went to A&E. They looked at the joint, they x-rayed it, they said, no break, it's probably just soft tissue damage.
It will heal
on its own. No other advice really given. She came to see me a few weeks later and said, Doctor, I still can't walk on it. I can't work. And she had a very active job. She worked in a restaurant. She couldn't work. And I checked the x-ray. There was definitely no fracture. I said, okay, well, if it's your knee, you've probably done... There's a lot of ligaments, big ligaments in the knee that stabilise the knee, the ACL being the key one, the anterior cruciate ligament. And I said, well, the only way we can look at that is by doing an MRI. So I sent her for an MRI and she had a very big tear of her meniscus.
And that's something MRI, snapped. They didn't do it.
Exactly, because there's no pathway there. If, for example, a patient comes in and it is just a soft tissue injury, again, we say, oh, it's just a soft tissue injury. Actually, a soft tissue injury can be just as impactful to someone's quality of life as a break. But we feel breaks are much more serious, much more, we'll get you referred to, orthopedics, and we'll have that looked at and, cast or, my patient wasn't even really given a knee brace. She was just given crutches and told it would get better.
I'm also thinking of the preventative side of sports and exercise medicine. Like if the medical system places more emphasis on sports and medicine, this might reduce the burden on emergency services, meaning that we won't get as many injuries as we get right now. Is this a valid idea?
Yes, I think there is an argument to say that if patients are more active and more conditioned, so they have better strength, better sort of fitness levels, then they won't get as injured doing sort of basic tasks of daily life. And the common one I always see is back pain. So I see a lot of patients who are overweight, and being overweight actually changes the biomechanics of your body. So if we put on weight, we tend to put weight on around the middle, around the tummy in some people. And if you've got more weight in the tummy, so I sort of maybe compare it to being pregnant, except for it goes on much more slowly than a baby. But if you're having more weight here, we tend to then lean back to kind of compensate that weight. That actually puts a lot of pressure on the posterior aspect of the spine, can make you a lot more prone to back pain as well as prolapsed discs and things like that. So I definitely feel if there's a good level of conditioning there amongst the general population with an improved core, improved posture, healthier weights, we can certainly reduce injuries and reduce pain problems. Yeah,
I would pierce my eyes with a needle and not wait at accident and emergency for hours. That's for me. But for my child, I would rush there. Once she was swinging off the monkey bars and she flew mid-air off the monkey bar and landed right on her back.
Okay,
we had to go there. And there, the doctor said to me something very, very useful. He first checked her heart and he spent a long time going back and forth and doing the heart. I was like, why are you checking the heart? And he said to me, a regular heart rate is a very good indication that her organs are fine, because if there was damage in the organs, her heart would be racing.
Yeah.
Wow. It's very clever.
Yeah, I mean, our bodies are amazing at dealing with injury, with dealing with stress. Certainly anyone who goes into accident and emergency will have their basic observations done. So at the front door, as part of triage, they'll have their temperature, heart rate, respiratory rate, oxygen levels, alertness levels. If it's been a head injury, they'll have what we call neuro observations done as well. So that'll be checking the pupil reactions, checking that the nerves are working, sort of, again, alertness levels, as I mentioned. So yeah, these are all done at the front desk, and it helps us to triage patients. So if we do have patients with abnormal observations, they are seen first. So it's our way of triaging in A&E.
Yes.
Yeah.
Nicole, your journey has taken you far and wide as both a team doctor and a medical advisor. You're currently the team doctor for the national cheerleading team. How did that opportunity come about?
Yeah, I mean, as I've mentioned before, I was a cheerleader for about 10 years. I competed on the national team for 4 years and won the world championships with my club team 2 years as well. So I competed at a very high level and made a lot of friends, colleagues in the sport and I'm really passionate about cheerleading, actually, for many different reasons. I mean, for starters, it's a female-dominated sport. So for females who are naturally dropping out of sport at 12 or 13 years old, we see it quite a lot. It actually holds on to those athletes because we see so many actually coming into the sport at 12 and 13 years old, which is brilliant to see. There's a place for everyone, no matter what shape, what size, what ability. There's so many levels. Obviously, there's teams of 24 to 30 athletes, so there tends to be a space for everyone at each club. It creates a whole team environment. So there's a social aspect to it, which you don't tend to get with things like gymnastics and your individualized sports. So cheerleading as a sport I think is excellent, and it's growing rapidly. So I wanted to stay within the sport and be able to give back to the sport. And I thought, actually, coming in from the medical side, which is actually quite depleted in the sport at the moment, there isn't much medical guidance or medical practitioners working within cheerleading. Yeah. So I think it's a massive area there which can be developed, and I'm really trying to, I suppose, lead it in a way, try and help sort of develop the medical guidelines, the sort of medical provision, medical understanding within cheerleading. So to a certain extent, it was quite seamless because it was pretty much the year after I retired. I think the managers sort of advertised a role for physio. It's voluntary, so you don't get paid for anything like that. And I thought, I'm not a physio, but I've got I'm a doctor and I've got an interest in sports medicine, and I also know a lot about cheerleading, having done it myself at that level.
The perfect candidate.
Yeah, I mean, I knew the coaches and I knew the managers. Some of the coaches were my coaches as well, and I knew some of the athletes, and I knew I could really empathise with what the athletes were going through. So part of it was very natural and very sort of easy. But yeah, it was certainly challenging as well, because I mean, it was the first time I'd worked in a team environment as an independent practitioner. I've got previous experience working underneath a supervisor within a team, but not as the sole independent practitioner. So that was new to me and a learning curve. But also seeing the coaches and the athletes adjust to having that medical provision and medical advice available, they're not used to it. So it took a bit of time to really sort of work out what my role was, what I could do, what I couldn't do, the trust that, the athletes and the coaches had in me as doing that role. So yeah, it's been a bit of a learning curve, but I think it's definitely grown into the role, and I'm really enjoying it. So
lovely. Yeah. When my child asked to join the cheerleading lesson at school, I said no. Then she nagged and nagged and
Yeah.
nagged. Then I reluctantly said yes, because to me, it's I saw it as an American thing, and I think I've become more English than the English people. But most importantly, I imagined it as tall, skinny girls in skimpy clothes, showing off how skinny they are, cheering for the boys. But you're telling me that this is rubbish. And is that cheerleading now? Maybe I should be asking about technical aspects of this. How is cheerleading like as a sport? Does it have unique demands and requirements in terms of performance recovery, a set of injury patterns? Explain this to us.
It's the most common description we get of cheerleading, particularly in the UK. If you ask someone what cheerleading is, they would come out with that. So it's not a bad, it's not a bad thing. It's just a lack of sort of understanding and education and knowledge on what actually is involved. I mean, cheerleading is the cheerleading that we do in the UK. I mean, there's different types of cheerleading within cheer itself. There's dance and pom cheer, which is incredibly technical dance elements with pom-poms, but they're done as a team and with lots of visual elements going into that and lots of choreography. And then there's cheer, which is stunting and tumbling and dance and jumps all put into 1 2 to 2.5 minute routine. I would say we don't cheer for anyone. We cheer for ourselves. We put on a routine on a floor in front of judges that gets marked, just like, for example, gymnastics. Yeah. You perform a routine in front of judges and it gets marked.
Tried to convince me. Just gymnastics,
it's
mommy.
Basically, it is like gymnastics, but it's within a team environment. So you've got 20 to 30 people competing or doing that skill all at the same time. So there's a high level of choreography involved, synchronicity. One thing I'd say about cheerleading is it's incredibly, incredibly demanding on the fitness and the body. So it's a routine is very anaerobic. So you really get a lactic acid buildup when you do a full routine. The speed of it is about 140 beats per minute, and you are hitting a motion or doing something on every single one of those beats. So to do that for 2 to 2.5 minutes at maximum intensity, whilst lifting people, being lifted, being thrown, doing your tumbles, doing dance in between. I have tried to emulate cheerleading fitness into a workout of my own at home or in a gym to help train my body for it. It's impossible. You cannot emulate it in a gym because of how unique and how demanding it is. You can certainly do exercises to help, but nothing will exactly match what that is. So yeah, it's very unique, very demanding. I highly recommend watching Cheer on Netflix.
Cheer?
Just Cheer. It's called Cheer on Netflix, but it follows some American high school cheer teams who are exceptionally elite, and that demonstrates perfectly demonstrates what the sport is.
Brilliant. Yeah. Nicole, we usually finish our episodes with big picture questions like visionary, ethical, moral, anything problematic is now. Okay. I've always believed that there are 2 areas GPs must understand deeply: nutrition and exercise, because I think mismanaging one of them might be an indirect cause of disease. For GPs who might be watching now, what is the one sports and exercise medicine principle that they should start applying today?
So a bit like you might ask about in a normal consultation, generic consultation, you might ask about a patient's smoking habits, whether they drink alcohol or not. I think try and make it commonplace to ask about their activity levels as well. And I think by doing that, we can start to identify the patients that are more, too inactive. And then we can use that as sort of a bit of a teachable moment and an opportunity to ask whether they would want to become more active. And then from there, you open up the discussion and advice on how they can become more active.
Yeah. What is the reaction that you get when you prescribe movement or physical activity as medicine? Do people think that you're trying to avoid giving them the real thing?
No, I think most patients who I've done it with have been very open-minded about it, and a lot of them have given some quite positive feedback, and a lot of people have said, oh, no one's ever put it like that to me before, no one's ever suggested that I try this exercise or that exercise. I've had one patient who came to see me with really high blood pressure, very, very overweight, very inactive, hadn't done any activity for years, because she'd very sadly hurt her wrist and had sort of gotten sort of a lot of chronic pain in that wrist as a result. And even the swinging motion when it comes to walking has made that wrist more painful. And because of that, she's put off all activity. And people have obviously just said to her over the years, you must get more active, you must move more, try and lose weight where you can, it will help with everything, it'll help with your blood pressure, it'll help with your pain, and things like that. And she's just been like, I just can't. And all it took was sort of it took half an hour, but we sat down and we spoke about ways in which she could become more active. And we did an exercise prescription from that. And the feedback was very, very positive about that. So on the whole, patients are very open-minded about it. They're very happy to try new things. They just need a little bit more time and a bit more detail into what sort of things they should try.
And it's probably because she's heard that from you, her GP, you're in a place of authority versus her friends telling her, oh, you should work out, kind of thing. What is the biggest challenge facing sports and exercise medicine today? The elephant in the room that no one is talking about?
I think the biggest sort of challenge I get as a sports medicine or a GP with an interest in sports medicine is, what makes you different from a physio? Because physios are very capable at dealing with assessing, diagnosing, treating, sports injuries and things like that. And I think the thing that's unknown is all the extra things that come with sports medicine. So obviously musculoskeletal care makes up a huge portion of it, like we've discussed. And there are elements to that which, physios can deal with fantastically, and they're a huge part of a sports and exercise medicine team. But there are some patients who are a bit more complex with lots of other medical issues, which maybe a physio would feel a bit more comfortable dealing with the risk of that. And a doctor is sort of trained to take on that risk a little bit more, as well as deal with the other medical problems that come with it. So, for example, weight issues, high blood pressure issues, and things like that. And then on top of that, you add in the exercise medicine side of things and dealing with all of those conditions and with the metabolic syndrome. And certainly, that is a position for sports and exercise medicine specialists that make us very different from just being a glorified physio, for example.
What's a trend or innovation in sports and exercise medicine that you are excited about?
I think it is the growth of it within the NHS that's making me quite excited. Certainly from developing sports and exercise medicine clinics to help with musculoskeletal care, but also to try and help with the obesity crisis and chronic pain and all of those kind of metabolic conditions like the high blood pressure, high cholesterol. I think sports and exercise medicine has a massive part to play there. So the fact that the NHS recognises it, although albeit small, there is NHS, sports and exercise medicine consultants working within the NHS. And I think that's really exciting. I think we just need to see it grow a little bit, but it's going to be a slow process.
Now, I have squeezed the policy making with the problematic questions because to me, politics is problematic. You're also a medical advisor on SportCheer England's medical committee. What kinds of sports policy changes have you been advocating for?
So SportCheer England is the national governing body for cheer within the UK. And I sit on a subcommittee, which is the medical subcommittee. And we help with sort of all things medical matters or mental, physical, health related to athletes that are sort of within cheer at the moment. At the moment, the big policy that we're working on is concussion and developing a concussion protocol that is cheer specific for England. So I'm on the medical committee with a physiotherapist, a clinical psychologist, as well as a sort of medico-legal lawyer as well. So we're working together to try and help build and improve the policy. And it's essentially a document that we're going to try and put together that will be available to the cheer community within England to help people recognise the signs and the symptoms of a concussion, help identify ways of preventing it, as well as what to then do in terms of treatment, and how to get diagnosed with it. But then following on from that, we're trying to develop a return to training or return to play protocol that is also cheer specific for concussion. So this is athletes who have had a concussion who want to return to cheerleading. They have to do it in a stepwise manner.
No, I see ads of AI fitness coaches popping out of my social media all the time. Do you see technology changing the landscape of sports and exercise medicine in the future?
Yeah, I mean, I think a lot of it is changing already, you know, with the sort of wearable technologies like the smartwatches and smartphones tracking all our health and tracking our fitness levels and how hard we're working. Yeah, I think definitely technology will be changing a lot of things. You know, we've already mentioned AI and ChatGPT advising people on injury diagnosis and management, which we obviously have to work around. And then, yeah, the AI fitness apps, I mean, there's already some evidence that suggests an AI generated fitness program has actually helped fitness levels in lung cancer survivors, for example.
That's definitely a very positive outlook on things. What's your own philosophy when it comes to wellness? How would you define a fit person?
I think you have to look at it differently depending on whether you're looking at sort of a member of the general population or whether you're looking at a specific type of athlete.
A regular person
trying
to survive the odds.
Because obviously fitness can be very sport specific as well. So no, I think if you're looking at sort of the general population, for me, fitness is the ability to do what you want to do in life for as long as you can with a good quality of life. So for me, fitness is the ability to do the day-to-day activities without an issue, without injuring yourself. It could be, for example, running around with your kids in the playground, running for the bus and not dying when you get on the bus. You know, as we get older, being able to sit to stand and walk in the park without having to rely on a wheelchair or a mobility scooter. It might be reducing your falls risk as you get older and improving your, you know, having good balance and coordination so that if you do miss a step, you don't fall over when you miss a step. So for me, that is what I would define as fitness. Not how fast you can run a 5K.
The practical everyday life. Right?
Yeah.
That's what it takes.
Yeah.
Sports and exercise medicine involves fast decision making in a very high stakes situations. You deal with fractures, dislocations, injuries, maybe on a daily basis. How do you personally unwind while you're operating in such a high energy environments?
I use sport and activity myself to unwind. I enjoy running, so I run myself. Again, I prefer out in nature as opposed to on a treadmill indoors, but that helps me process my thoughts. Again, it makes me feel good and less stressed and less anxious afterwards. I personally really enjoy yoga as well, so again, just doing I use yoga not only as a way of helping with my flexibility and my balance and coordination, but I also use it as a mindfulness exercise to help with my mental health as well. So it really kind of takes my mind off of the busyness of the day, of what's happened or what's to come. And it just really makes me focus, because there's an element of breathing exercises with yoga as well that can really calm the mind.
Who's your biggest cheerleader?
So I'd probably say my partner is probably my biggest cheerleader. Yeah. So I actually met him doing cheerleading.
Really?
Yeah.
What does he do?
Sorry?
How did you meet him in that environment?
Yeah, we were on the same team. So I was on a co-ed team, which is obviously male and females. And yeah, we met there. So he's exceptionally supportive and positive. You know, if I'm having a down day, he'll always pick me up. And again, he's very supportive in all my sort of professional decisions that I decide to make. And yeah.
That's amazing.
Yeah.
Nicole, you're a strong advocate for the idea of exercise as medicine. And today you have reminded us of just how powerful that concept is. You have shared with us strong evidence that exercise medicine can manage, can treat diseases, conditions. You have also taught us that exercise medicine can be part of everyone's lives, whether it's a teenager struggling with growing pains, a professional who is trying to reduce stress, someone recovering from surgery. There is a place for exercise in everyone's lives. Thank you so much for your insights today. Thank you for the work you do, especially for our young people. And thank you for being with us today.
Oh, you're welcome. Thank you for having me.